Your Excellency, Deputy Governor Makueni County, my colleagues invited here as guests, as healthcare workers, students, everybody who's in our midst this afternoon, I am grateful to take this mantle, just a few minutes, to share a few words with you. My name is Dr. Samuel Kinyanjui, the Country Director of AHF Healthcare Foundation here in Kenya. AHF Healthcare Foundation as an organization is an international NGO working in 45 countries in the world, and 15 of those ones in Africa, and in Kenya we are working in 10 counties. Your Excellency, my heart is happy to be in Makueni County because Makueni County and Mombasa County were the first counties where AHF set foot in this country in 2008. And we have remained here, and the last 3 years we have expanded tremendously. I think of the main facilities, only water we are yet to provide service. We have about 300 staff in Kenya, and I strongly believe about 30-40 of them are in Makueni County. And this coming year, we are planning to support the county in addition to expand space for Makindu Clinic, TB/HIV clinic, to ensure that our clients have sufficient space, because one of the reasons a lot of the clients are consistent in care is because of privacy. You find a situation where two doctors are sitting next to each other and the patient have to give personal information in the earshot of another one. This really is not good. We really appreciate the kind of support we've received from Makueni County since the years of 2008 and now. And now looking at the statistics that I'd like to mention, first of all, I'd like to appreciate the leadership of Makueni County and the leadership in the health department. For this is, like I mentioned earlier, that this is only one out of 5 counties in Kenya that are set aside money for TB and TB/HIV in the county budget. Lots of the other counties depend on national government, and as a result, a lot of things remains undone. In addition, I have noted over the years, particularly over the last 2 years, the support that the department has had, concerted support to improve something we are called active case finding, because a lot of the biggest, out of the 5 main challenges in controlling TB, number one of them is TB case detection. The people who remain undetected with TB in the communities, because these are the people who continue to infect others, members of the family, where they work and where they socialize. And Makueni County has gone ahead to do this, and would encourage. I think we have had a number of CMEs with the county, and maybe it can be attributed to the good numbers, statistics that I'm noting here compared to the national government. Globally, like it has been mentioned, 2022, after the recovery from COVID, 11 million people were confirmed to have TB, and out of this, we lost 1.5 million. Here at home is that about 90% of here at home, about 90,000 cases were found last year. And the treatment rate, if you notice, is about 85% treatment completed. Cured is much lower. But for Makueni County, is way ahead of the pack at 92% treatment success. This means that in Makueni County, nearly all the people who are found and put on treatment will recover. So our greatest, yes, I am happy to be associated with Makueni County for this excellent work. In addition to this, nearly 97% of people who live with HIV are put on TPT, TB preventive therapy. This is very, very high. However, we have challenges that need to be mentioned. One of them is TPT, TB preventive therapy for people who come from a family where somebody has been diagnosed with TB. This is still low at 1%. We need to increase this one going forward. The other issues I wanted to mention here that contribute is that while globally the target is to reduce TB death by 80%, globally this has only been managed to at 67%. If you look at our local numbers, they are way above 80%, and therefore we have already met that target. The challenge that we have is a lot of our staff, our people in Makueni County, the men are predominantly affected. At 67, we can easily just call it 70% of the people being diagnosed with TB and dying of TB in Makueni County are men. I'm posing there for a reason. Because men are the leaders of the household. They will lead in our economic development. And when you see homes without men, then this is a big challenge, particularly the age group that's dying. Mulay mentioned them here, and these are between the ages of 24 and 44 years. The most vibrant, economically vibrant, and in all other aspects. So what are the main reasons? I want you to, we kept asking, what is the main reason why TB has remained an enigma and a killer of our people millions of years, maybe thousands of years after it was discovered? As I mentioned earlier, TB was known as early as the days we knew leprosy, before Christ. And TB was a big thing in the West, particularly in Europe, killing millions of people until the late 19th century. And just with this, with what they set aside called sanitariums, in which case they just used to build high up in the mountain, big windows, make sure that the people are on a good diet. They didn't know any treatment, but they would isolate the sick and stop the transmission. TB went down. However, 80 years since 1944, when we found out, when the first cure for TB, or streptomycin, was discovered. Why is it this disease has remained a predominant killer of our people, particularly in Africa? And there are a few reasons we'd want to mention. Number one is that the diagnosis has been left to very few healthcare workers. The healthcare workers in Makueni, nurses, I'm looking at the clinicians, those who make diagnosis, nurses, clinical officers, doctors. How many of them are actively asking those screening questions to each patient they see? When the day comes that we do that, then we will not miss any more additional cases, and soon the cases will go away. So this is my first humble request, that we intensify active case finding. Number two, the funding that we have for TB, TB HIV, we appreciate that it is there in Makueni, but it needs to be redoubled, noting that even for Kenya as a country, last year, the budget they had was $27.2 million US. This is combining what government is giving and all other partners, and which this is 50% of the requirement. That tells us that the budget available for the same in Makueni is in the same range. The next thing is about the silo system. I don't know whether it has remained there, but the days I used to work for government and working for TB chest clinic used to be like an all-go zone. It used to have its own special people. Some patients admitted in the ward, they'll be told, oh, this one will be seen by the TB people. This one will be seen by people from CCC. I pray that this is not scenario in Makueni, and if it's not, maybe it may explain the good outcomes in the TB treatment. The other issue is about patient factors. A lot of the time we have dwelt here on patient factor, reminding the people the signs and to come to the facility, and reminding the people that TB screening, TB diagnosis, and TB treatment in its entirety, it's free. to the user. I am insisting the user because somebody else, which is the county government and partners and the national government, bear the response. So those drugs are not free. They are free to the user, but money has been invested in that. So those are significant investment that people need to take care of to control this disease. Finally, I'd like to address a couple of myths and misinformation that happily the student mentioned. Number one is that TB is an infectious disease. It is not a curse. It is not kiboko ya Mungu. It is not the wrath from the gods. And it is not witchcraft. And therefore, it's fully curable and people recover fully. However, I also want to mention the real reason, some of the reasons we speculate that why men are getting it more and where a lot of them are dying from TB. One of them is the fact that it has already been mentioned, men will not want to go to the hospital until they are very, very sick. They would like say, this cough of mine, I think it needs some spirit, kidogo, and hot water and ndimu. They put the ndimu in the hot water, they kill the vitamin C, and they are drinking only bitterness. Number two, for men, is, and I'm looking in its entirety, where we go to get our evening drink. Look at the environment. A lot of those, where I come from in Embu, they say kituo. They are tiny, tiny places like those ones. Tiny, dark, no windows. And the bacteria can be hanging in the air for hours or days, waiting for people to inhale. And the people are crammed there, and the chances of getting infected are very high. And number three is our nutrition. Men are not the most healthy when it comes to nutrition. Don't look at our weight. Because most of our time when pesa iko kwa mfuko ni kanyama choma na ukaka ugali na kauki. The things we call vegetables, we've left them to the rabbits. Sindio? Hii mboga hii ya sungura. Matunda tumeachia nani? Matunda ni ya watoto. Hata mzee mwingine sikia kiulizo, kwani unakula matunda ya mtoto? He is the one who bought. He should eat. So all these factors contribute to this. Then particularly men, we are also very daring and take a lot of risks. So all these combined factors, but the fact that we delay coming to seek treatment, the fact of where we socialize and play, and our nutritional status also contributes to this. So we need to go out and find them wherever they are. I am particularly impressed that we have X-ray, digital X-ray, and particularly that is AI enabled. We know that the technology is as good. Back in 2012, when we were piloting, the technology was as good as the best radiologists we had. Now, 12 years later, I am certain that the AI will pick things that are, if I was a radiologist, I would most likely meet. Because sometimes they may have mood, I may be having a bad day, but the AI does not have a bad day. It always look for those, to always apply the formula, the algorithm consistently in each of the exposures that you get. So this is a very good thing. We also noted in the last research that X-ray was more sensitive in screening for TB than gene expert, even than culture. So I am particularly impressed. So Makueni County and the partners, kudos to you. So I don't want to belabor the entire day. I'd like to remind us that what we need to do is that everything starts with us. I'm particularly impressed that the people we had here are students who have a lot of influence now and in future. Anyone has ever seen a Coca-Cola? I'm not advertising Coca-Cola, but I'm just saying, have you ever looked at the Coca-Cola billboard? Ever seen a man of my age on those billboards? No. Why? Who are there? The young people. Because the young, you cannot influence an old dog. It's very difficult. Okay? But the young people, you can make an impression on them. Even if they don't have money to buy, they will put pressure on the parents until they buy. And in future, when they get hooked on it, they will be able to pass the same to their children. So when the young people get the correct message like they are getting it, I am sure we are on the right road to conquer TB in our lifetime. I'd like to end with the words, I may not be able to quote them verbatim, the words of WHO, the General Director of the WHO, Dr. No, I'm looking at the WHO Tedros, Dr. Tedros. He says this: millions of previous generation died from TB without ever knowing what's killing them. The tools we have now, they could only have dreamt of them. The tools and technology we have is sufficient to end TB in the next 10 years. The key question is, as a community, as a global society, as the people in Makueni, are we ready to implement them? Thank you. God bless you.
Asante Daktari, tumpigie makofi tena. So thank you for your support. AHF has been a partner to us, as you've said, and for those words, especially to the boy child. Okay, so next we'll have our chief guest, the Deputy Governor, Your Excellency. So nataka tusimame na tutamkaribisha in style